Hi, I'm Dr. John Chisar, the President and CEO of the GBMC Healthcare System, and I would like to welcome you to the virtual Walk a Mile in Their Shoes. Domestic violence and sexual assault will only stop in our community when people rise up against it.
Good morning, I'm Erin McPherson with WMAR 2 News. Over the last 5 years, GBMC's Sexual Assault and Forensic Examination, known as SAFE, and Domestic Violence Program has handled nearly 3,000 cases. And now, in an effort to save lives during COVID-19, people across the country have stayed at home for over a year. But whether we're in a pandemic or not, what happens when home isn't safe?
And she just said, wow, I could have been dead.
She's fleeing with her siblings. She didn't have shampoo. She didn't have toothpaste. She didn't have underwear or clothing for the kids. She didn't have snacks for the kids. She had nothing.
She was trying to walk to her car to go home. And as she left the bar, her friends didn't want to go with her. So she decided she was going to go by herself. She walked towards the parking lot, and as she got into the parking lot, she was assaulted.
To better understand what's happening to victims of sexual assault, child abuse, and domestic violence, we'll speak with the GBMC Safe nurses, leaders, and community members who work so hard to support them. But they can't do this work alone. It's going to take all of us to be part of the solution. This is the virtual Walk a Mile in Their Shoes.
As healthcare, we've still been here every day. We still provide care 24/7, 365, despite many other places transitioning to working remotely. Initially, we had a decrease in the number of patients that we would see, but we also knew with the nature of the work that we do and the abuse situations that our patients are living in, we knew that they didn't stop just because our numbers initially dipped a little bit. If anything, it was getting worse because they were stuck at home with their abuser. They were in a position where they weren't able to make a phone call safely to look for help or go on the internet to search for different places and resources that they could go to for help. So they were kind of stuck in those situations until things started to lift or until their abuser went to work or went to the store and they were able to make those phone calls. And that goes for adults and children, older adults living in a abusive situation as well as kids who are at home being abused by a caretaker. So after things started to lift, after some of the kids started to go back to virtual school, people started to go back to work, and the survivors were able to safely make that phone call and make that contact. We've seen an increase in not only the number of patients that we've seen, but also the severity of the injuries that they're sustaining. In the past, it wasn't uncommon for patients to come to us after an assault where they were hit or smacked or slapped or hair pulled. Now we're seeing more broken bones. We've had several patients come in with the bones around their eyes broken, their jaws broken. We've had patients who've been strangled severely. They've had bleeds in their brain as a result of the strangulation. We've had patients who've had to stay several overnights in either our ICUs or on a floor just because of the injuries that they've sustained.
After hearing Valerie, it's apparent that GBMC's SAFE and DV program needs your support now more than ever. Dr. Fred Chan, co-chair of the Walk a Mile Committee, is here to talk about today's event and how it supports GBMC's SAFE and DV program. Dr. Chan, can you tell us a little more about Walk a Mile?
Walk a Mile in Their Shoes is a yearly event that benefits the Sexual Assault Forensic Examination and Domestic Violence program at GBMC. It is the only program of its kind in Baltimore County that provides free, confidential service to victims of all ages. This year, taking into account of COVID-19 related precautions and for safety of all the participants, it is being held virtually. Started on April 1st, walkers have been logging their miles to help us reach the goal of 2,891 miles which represents the number of patients the program supported over the past 5 years.
Thank you, Dr. Chan, for that explanation and for your commitment to advocating for victims of sexual assault, child abuse, and domestic violence. For those of you tuned in at home, I want to remind you about 3 things you can do to make a difference today. 1, if you haven't already done so, visit gbmc.org/WAM and donate. 2, use the form on the Walk a Mile website to log your miles. As Dr. Chan said, by midnight, we want to reach 2,891 miles to represent all of the patients treated by the Safe and Domestic Violence Program over the last 5 years. 3, take a photo or video of yourself walking and share it on social media. Don't forget the hashtag GBMC Walk a Mile to help get the word out. It's going to take all of us standing together to eradicate this violence that is happening in our community. Next, we'll speak with Bonnie B. Stein, co-chair of the Walk a Mile Committee and community volunteer for GBMC. Bonnie, I understand you've had a personal experience with this issue. Would you mind sharing your story?
Several years ago, when my granddaughter was a freshman at the University of Tennessee, the value of what we do was brought home to me in just an instant. I got that horrible phone call at 3 a.m. in the morning from her, and one of her sorority sisters she thought had been drugged and raped. And, Hannah has always walked with me with Walk a Mile. And so she's calling me, asking me, what do I do? And it just really brought it home that it can happen anywhere. It can, these things do happen. And this girl's injuries were not just physical, they were emotional. So my advice to my granddaughter was to take her to a local emergency room, which she did. But it was interesting. It was very different from the care that she would have gotten at GBMC because it wasn't a separate emergency room. My granddaughter shared with me that she felt like her friend was victimized a second time because everybody was talking about what she had been through. There was no confidentiality. There wasn't privacy. There weren't follow-up services. It just brought home to me the value of everything that we do at GBMC in the Safe and Domestic Violence Program, that where we care for people at their most vulnerable moment, probably the lowest moment in their lives, and they need every level of support, and our program provides that. And it just makes me want to, figure out how to raise even more funds to support this wonderful work that they do.
Thank you, Bonnie, for opening up and sharing that experience. Sadly, stories like the one Bonnie just shared happen each and every day. In fact, statistics show that 1 in 3 women and 1 in 6 men in the U.S. have experienced sexual violence in his or her lifetime. But these aren't just numbers. They're friends, neighbors, family members, children, and even grandchildren. And when something this tragic happens, you want them to be treated and cared for, as they are at GBMC. Here's the story of Susan, a GBMC Safe nurse, and how she cared for a young college student.
She was trying to walk to her car to go home, and as she left the bar, her friends didn't want to go with her, so she decided she was going to go by herself. She walked towards the parking lot, and as she got into the parking lot, she was assaulted. At that point, she stated she didn't know what to do, so she went back to the bar and found her friends, who then called the police for her. She had the police interview. She came to us for the exam. I was here. She came with detectives. We went into the exam room. I asked her what happened. I got that story, an interview, and I just looked at her and I said, "You know that this wasn't your fault, right?" And she just broke down in tears. And she's like, "I didn't think I would be believed." I said, "I believe you. I believe this happened to you. And I'm going to be here to help you through it." She was phenomenal during the exam, so brave, so courageous, just telling me her story. And then when we were through with the exam, we were able to then let her talk to detectives again. And it turned out that not only did they find him, but they found video of him doing it. We had this, proof that you don't normally get. And I think at that moment, she really broke down, and I just hugged her.
Thank you, Susan, for sharing your story and for your commitment to your patients and our community. As you watch, remember that every donation makes a difference. GBMC's Safe DV program is completely free and confidential. Nurses like Susan perform detailed medical forensic examinations, take documentation, and collect forensic evidence that's taken directly to Baltimore County Police Department Crime Lab, which can lead to criminal prosecution. These services, as well as an evaluation of injuries by an emergency department physician, are provided in a private, secure suite that's completely separate from GBMC's emergency department. Next, Evelyn, a safe nurse with a background in emergency room and trauma nursing, will share with you what it's like to testify in court and the unique challenges safe nurses have to navigate.
I think it's difficult for people to understand that oftentimes we don't know the outcome of our patients. We might see them in a court trial, and that's difficult too because you can't acknowledge your patient because you're there testifying and you testify to your exam, so you're really not there for the prosecution. You're not there for the defense. You're not so much there on the patient's side. You're not testifying on their behalf. You have to stay in the middle of the road. I've testified about 10 times, and the patient's sitting right there, and I can't acknowledge them because I can't seem biased. And that's difficult. I tell the prosecuting attorneys to please let them know that I saw them, I recognized them, and that I was very sorry that I couldn't acknowledge them.
When we as a community think about the critical work being done by nurses like Evelyn, it's hard not to wonder what we can do immediately to help. While it's critical to support Walk a Mile in Their Shoes today, victims of sexual assault, child abuse, and domestic violence need our community support year-round. Here with us now is Lucky Thompson, co-chair of the Walk a Mile Committee. Lucky, why should viewers consider giving back throughout the year, and how can they do so?
I think that's very important as we consider today is a wonderful event, and we look forward to it each year. These nurses and the leadership of the Safe Department work 24/7, 7 days a week, and they really need our support throughout the year. Something that can be donated, such as gift cards, toys, clothing, toiletries, that goes so far to help support these victims. People don't realize, as part of an exam, victims are not allowed to shower and often have to leave their clothing as part of the evidence. So providing new clothing and toiletries for them to use can really go a long way. And it's something that, can make a huge difference at the end of an exam. So if you're interested in that type of donation, it's so appreciated. And any information can be found online at gbmc.org/safe.
Thank you, Lucky, for all of your dedicated work and advocacy on behalf of victims of sexual assault, child abuse, and domestic violence. GBMC would like to thank the participating sponsors of today's event for their support. Watch as one of our sponsors, Jerry's Toyota, explains what Walk a Mile in Their Shoes means to them and why they chose to be a sponsor.
Jerry's Toyota is proud to have sponsored GBMC's Walk a Mile in Their Shoes since its inception 6 years ago. We are proud to do our part in preventing domestic violence and spreading awareness in the greater Baltimore community. Thank you for taking the time to join us in this cause.
Welcome back. Now I want to shift gears for a moment. 1 month prior to Governor Larry Hogan declaring a COVID-19 state of emergency, GBMC's Safe DV program opened a newly designed victim-centered unit with 2 state-of-the-art suites equipped to provide the highest quality of care to victims, regardless of their age, ethnicity, or economic background. This space also includes special facilities and technologies designed to meet the needs of their growing pediatric population, I'll let Kelly, GBMC's Safe Community Outreach Coordinator, tell you more about the space and the difference it's making.
When it comes to child abuse, it's really hard when a child is trapped in a home and they are trapped there with their abuser. Some of the cases that we have seen have just been, things that you don't even want to believe that would happen to a child. The fact that GBMC Safe has partnered with the Child Advocacy Center made us able to still treat those children and not have any, hiccups in that process. So it's not like the child is jumping from one place to the other place to this place. We're able to bring them right here. They're treated, it's a one-stop stop. They're treated right here. They don't have to go anywhere. The detectives are here. We have the capability to interview here, to do the exam here. I'm glad that we have this new space and all these capabilities because we didn't know that COVID-19 was going to hit when this new unit was provided to us. But it was a godsend that it's here because we have been able to treat so many children and adults in need that who knows what would have happened if we didn't have that capability.
Prior to COVID-19, I actually had the opportunity to visit the safe space that Kelly talked about, and personally, I'm proud to have this facility right here in Baltimore County. However, excellent, dedicated care is about more than just the space it's provided in. To accompany their work inside the hospital, the SAFE team also works with agencies and nonprofits to ensure people know the warning signs of abuse and violence. Laura Clary, SAFE nurse and the clinical program manager, is here with us today to tell us a little more about the red flags to look for. Laura?
So again, there's a lot of different things that people can look for. And a lot of times we see this as a cycle where the violence will start off as something a little bit milder, maybe not physical initially, but then we see it escalate, especially in times of stress like this when people are stuck under one roof or there's financial strain, there's childcare strain. All of that puts additional stress on the family as a whole. So if they start to see little things happening, verbal abuse, being called names, if you do need to leave the house to get groceries but you're not allowed to, or controlling finances, we see this type of stuff happen and then we often see it escalate. You have to everybody is an individual. You have to decide what's the safest route for them. So whether it be going online and finding a resource that you can reach out to via the computer or a hotline that you can call, or again, just phoning in to our program just to ask questions to get support or to speak with an advocate, we're here for you.
Thank you, Laura, for what you and your team do each and every day. The work that GBMC's Safe and Domestic Violence team performs is comprehensive, extensive, and most importantly, necessary. GBMC is proud to offer these services at no cost to patients, so there's always someone here for victims and their families when they need it most. But this wouldn't be possible without you and the support of our greater Baltimore community. If you're worried about someone you know and don't know how to help them, please listen to the words of a vet, a safe nurse who's committed to what she calls truth in love.
I think when we see something that's off, when we know something is not right, I think it is our responsibility, not just as healthcare providers, as good neighbors, as family members, as friends, to speak the truth in love, if you will, the truth with compassion. I think sometimes we get the word compassion mixed up, or we get it confused. We think it's only about telling the other person what they want to hear. Because when I'm being compassionately truthful, I'm giving that person a sense of control.
Thank you for tuning in, and I hope you enjoyed the virtual Walk a Mile in Their Shoes. benefiting GBMC's Safe and DV program. Remember, there are several things that you can do today to help support this important cause. 1. Walk and log your miles. Send a picture or upload one to social media, and don't forget to hashtag it GBMC Walk a Mile. 2. Make a donation at gbmc.org/WAM. 3. Share this program with your family and friends to let them know that they too can make a difference. For WMAR2 News, I'm Erin McPherson. If you or someone you know needs help, GBMC is here for you. 24 hours a day, 7 days a week, 365 days a year. Please visit www.gbmc.org/safe-dv or call 443-849-3323.